Nidra, you're on mute.
I'm going over everything and I'm on mute. Let me start over. Hello, everyone, and welcome. Thank you for joining us for our virtual open enrollment fair session. Today, we will go over Kaiser Permanente medical benefits. Before we get started, I would like to brief everyone on a couple of housekeeping items. All attendees are muted and will remain muted throughout the presentation. And if you have a question, please feel free to type it in the chat box. Be informed that if you do put a question in the chat box, everyone attending the session will see your question and your name. So if you have something that's very sensitive or confidential in nature, please reach out to the benefits division and we'd be happy to assist you with answering any questions and concerns you have. Lastly, today's webinar is being recorded and a copy of the recording will be posted on the Benefits Open Enrollment website. At this time, I will turn it over to our presenter, Charlotte Souza. And I hope I said your last name correctly, Charlotte. Forgive
You
me.
did, Nidra.
All right.
Thank you.
Take it away.
Thank you. Good afternoon, everyone. Thank you for having me here. This is the first of three open enrollment meetings that we will have webinars. And just want to thank you for having me. I'm excited to give you some information. What I'll do for those of you who are interested in Kaiser Permanente and not familiar, I'm going to give an overview about Kaiser Permanente. And for those of you who are currently with Kaiser Permanente, I have a lot of information, so it'll be updates for you. So we want you to take advantage of all the resources you have that's offered to you being a member of Kaiser Permanente. With that, let's get started. And my name is Charlotte Souza. I've been with Kaiser Permanente. I'm going to be going on 30 years now. I was 10 when I started. So, so I've been with Kaiser almost 30 years. I'm very, very proud of this organization. This organization has been around for over 75 years. We are not just in California, we are in several other states, a total of 9 states. And we'll review that when we get to the travel section. But we have 12.6 million members. And so we have a very large population and we have a very robust electronic medical record, which makes us, the technology is just incredible. With that, as you know, we are the health plan and we own and operate our own facilities. So when you see Kaiser Permanente facilities throughout, that's us. We're all integrated. It's an integrated model. And as you see here in this slide, you're connected with the primary care. The specialist can see the medication that the primary care doctor is prescribing. The labs and x-rays are also connected. The telehealth services are part of your main doctor as well in the health plan. And right here, it basically means that you are at the center of all these different connected avenues. So with that, I just want to mention that it's just having that electronic medical record just makes it easier on you as well. As a member, you have access to part of that electronic medical record, and you can communicate with your doctor online. You can order prescription refills and so much more. It just makes it so much nicer. The great thing about the doctors having access to that is they avoid any duplication. Let's say you go see a specialist and the doctor already had all these labs and x-rays and all that, and you're being referred to a specialist. The specialist can see the same information, the same results, so you don't have to be duplicating effort. If you go to the emergency room, all your allergies, reactions to medication, all that is highlighted in the system. So it's at their fingertips and they know what not to prescribe you. So it's very, very safe. So with that, I'm going to move on. I do want to talk about our Kaiser Permanente doctors. You'll be seeing Kaiser Permanente doctors. These doctors come from the best schools all over the country. They come in and the difference is that they are paid on a salaried basis. They don't have to worry about running a business, paying rent. Their focus is taking care of our members, and they're connected with the electronic medical record. We do have a lot of them that are bilingual, and we also have interpretive services available for them if need be. A lot of our doctors come out in the Top Doctor magazine in the San Diego area. So we do have a lot of those. And then also our doctors are connected to the specialists. So if you go in and a doctor needs to get some recommendations on a certain specialty, we have specialists that are on call where they can just pick up the phone and connect with that specialist and avoid you from having to go to the specialist and be getting the same information. So lots of great stuff. With kp.org, you can look at the profiles, how long they've been with Kaiser Permanente, male or female. Are they board certified? We have over 90% of our doctors are board certified, which is a highly recognized credential in the medical profession. So you know you're getting the quality of care that you need. One thing to note is we are a traditional HMO. So you're attached to that primary care doctor. With Kaiser Permanente, let's say you're commuting and your doctor is close to your work. When you go home, you're able to see a doctor. Let's say it's you're on vacation and you don't feel well, then you can call and request to see another doctor in that other location. So you have a little bit of flexibility. And then, of course, you can go to the urgent care centers. Remember, you can change doctors anytime or as many times as you would like. These doctors, again, connected to the electronic health record, and they have a team of care professionals with them, and this includes the specialists. And the record for you is available 24/7, 7 days a week. I do want to mention that, what did it say right here? The system also alerts our doctors. Let's say you need preventive care, your mammograms or pap smears, your cancer screenings or physicals, they have that in the system where it reminds them. So when they see you, they can tell you, hey, don't forget to get your mammogram, or you know, you need your cancer screens taken care of. I can order them for you so you can get that taken care of. The nice thing is if you go see an optometrist or a dermatologist, which is outside of the primary care, they also have those checkups that come up in the system. So they can also remind you of that if you need a certain preventive care that you are due. So safety is definitely on top of our list. So you can do same day, next day, weekend appointments are available with your Kaiser Permanente doctors. We're talking about routine care. This is in addition to urgent care centers. One thing with our facilities, we're all over California, and you can, as a member, you can see any of those facilities. Most of our facilities have everything you would need: a primary care division filled with family doctors and internists, pharmacy, laboratory, and x-ray. So when you go see your doctor, you can take care of all that other stuff, and you don't have to be driving all over town. So it's very, very convenient. So you're probably getting one of the, oh, excuse me. So let's say you go to urgent care or a same day appointment with a different doctor, they all can see your medical history, or if you're allergic to any medications. Now, as a member on kp.org, if you register on kp.org, you can order prescription refills, have it mailed to your home. You can check in for appointments, book appointments, cancel appointments, pay your bills. You can see your lab work results. You can even communicate with your doctor and his care team, and they'll respond back within 24 to 48 hours. One thing is this one here that says 24/7 care by phone or video. There's two things. One, you can schedule appointments with your doctor via telephone or video, which is available at no cost if you are on the traditional HMO plan. There's a small cost if you are in the health savings accounts, the high deductible health plan, which is the low plan. This Get Care Now is a new feature that started first of the year last year. And again, it's no cost if you're traditional HMO, small cost for the high deductible health plan. But that Get Care Now, you can call from anywhere in the United States. If you don't feel well, you can, and you can call that number as well. They are licensed to take calls from anywhere in the United States. There are a couple of states that are probably not part of it yet, but they can address your questions. When you go on kp.org, there's a feature that says Get Care Now. If you click on it, it'll let you know how long is the wait, 20 minutes, 30 minutes. It fluctuates depending, we're entering flu season, so it fluctuates. And it'll tell you how long it will take you to speak with a clinician. And that provider can assist you. That provider has access to your electronic health record, so they know what prescriptions you're currently taking, and they can better address your needs at that time. So it's a really cool feature. Take advantage of that. You also have the e-visit, which is a small questionnaire, and then it'll tell you what to do, whether it sends for a medication or lab work, or maybe based on your answers, you probably need to see the doctor. So it'll advise you what, depending on your responses. A lot of technology here, so take advantage of that. You also have the Kaiser ID card on the app as well. And again, you can use your smartphone, your tablet, or in the computer. When you order your prescription refills, you can have them mailed to your home. The new feature is you can have it delivered same day or next day delivery. That's available at a small fee. So just remember that if you need it on a more urgent basis, they do have the capability now, although there is a cost attached to that depending on the postage. So those are one of the new things that we are offering. Travel. Let's talk a little bit about travel. If you are traveling anywhere in the world, you're covered for emergency and urgent care. Now, if you're traveling abroad, we have the kp.org/travel line, or a phone number that you can call before your trip. If something happens during your trip, they can answer those questions. They're available 24/7. Or after your trip, if you had a claim, they'll help you with filing the claim and being reimbursed if you're outside of the country. Now, so we cover across the United States. We also cover internationally. I mentioned we are in several states. We are in California, Oregon, Washington, Hawaii, Colorado, Georgia, and the Mid-Atlantic states. If you happen to be in those areas, you can be seen as if you were here in your home area. They will set up a new medical record number for you, and then you can use it from continuously. Even if, well, let me talk about the urgent care. So if you happen to be in these states that have the square, the triangle and the circle, we have partnered with mini clinics that include pharmacies, and then also urgent care, Concentra urgent care centers, the Cigna PPO network, and some mid states, the little clinics. What that means to you is if you have an urgent need, just go to one of those facilities and you just pay your copay. And you won't have to file a claim, wait to be reimbursed, and so forth. So that just makes it easier on you. So you have partnership. We have partnerships with these organizations. So just to make it easier on you. If you have questions, you just call the Kaiser travel line for assistance. So, so we do get a lot of recognition. We have a percentages because we have the electronic medical record. We can obtain statistics, and we can see that we are 33% more likely to survive from heart disease, and also survive from colorectal cancer screening. I mentioned earlier the preventive screenings, that we are always on top of that. That what makes, you're catching things early before it becomes severe. So not only is it's saving a lot of money on you and the health plan, but in the company, but you're also having not to go through such something so drastic. So just saving yourself from that disease, the colorectal cancer screening. My mom had that and she survived it, thank goodness. But it's a nightmare if you don't get it taken care of as soon as possible. So we do the fit test for those of you who, there's a certain age that you start, and you do those every year. And you just click on your kp.org app, click, I want to send it home to my home, and you take care of it on your own. You send it back, and that helps so much in determining if you need additional care or if you're good to go. So, and then again, all those preventive screens that you take care of just avoids detrimental stuff that can happen in the long run. We have a world-class maternity care team. So once you know you're going to have a baby, before your pregnancy, during your pregnancy, and then after your pregnancy, we have a comprehensive prenatal care team, and that's connected with the electronic medical record, and it's pretty robust. And let's say you have a condition that's maybe high blood pressure or another type of chronic condition, those care plans are tailored for you and your baby to keep you safe and your baby safe as well. They provide health education classes on nutrition, how to breastfeed if you're going to breastfeed, or your spouse. And also the website, the one that you see down here, kp.org/maternity care. It's pretty robust. It has each trimester, what to expect on each of the trimesters. So it's pretty comprehensive. We're very proud of this department as well, but it's basically all our departments. Here's another department, our mental health department, behavioral health. There's a high demand, and it takes care of the entire spectrum from anxiety, depression, addiction, autism spectrum disorders. We have psychiatrists, psychologists, and therapists that you can see over the phone or in person on a one-on-one basis. And remember, if you're seeing one-on-one in person, you pay your office visit copay or your cost. And if you're seeing your specialist via telephone or video, this includes our psychiatrists and therapists, then the costs would be at no cost for the traditional and a small cost for the high deductible health plan. And we'll talk a little bit, once you're done with the deductible, then there is no cost. This particular department, you do not need a referral from your primary care doctor. You just call them directly and make your appointment. And also they provide classes a little bit more tailored about depression, and so many other classes that you can learn for depending on what your situation is. And we have a lot of self-care resources that you can also obtain, and we'll go through that right now. But improving sleep, so important, practicing mindfulness, and so much more. So the news is, this came out maybe a month ago, maybe a month and a half ago. But for the Southern California members, there's a single phone line that has been created. You should have gotten either on kp.org through the messaging or on hard copy. But this is a phone number that you can call. If you're not sure what you're supposed to do, you call that number and they will triage the call and direct you on where you need care. Now, remember, if it's something that's life-threatening, threatening to your health, then you call 911 or go to your nearest hospital if it's that. But if it's not too urgent, call this number and they will assist you and direct you to the right and appropriate care. So that number is right here. You can see that our primary care doctor is also equipped with addressing and assessing your situation, and they can also direct you where you need to go. They're equipped with information and they know what to do. You can talk with your doctor on that. Our specialist as well. We have both mental health professionals and substance use disorder. And I mentioned emergency, but there's so many other resources if it's not too, for you to learn and avoid from it getting to that point. So here's it. It just gives you on a more detailed basis. Here's that phone number again, that it's available 24/7. And again, your doctor is also one of the best resources as well. We have lifestyle coaches that are over the telephone or web-based. The telephone ones is for sleeping better, reducing stress. These coaches are certified experts in these topics. And then we have the self-care apps that they'll talk about shortly. One thing I do want to mention is that you have the individual visit with your therapist, but there's also group visits. When you do a group visit, then you would pay half the cost of your cost share. So if you're in the traditional HMO plan, you would, I think you're 25, so you would pay like half of that, $12, $13, somewhere around there. But if it's a telephone, it's no cost. For the traditional HMO plan, high deductible, small cost. Okay, so let's talk about the self-care apps. That sort of ties in with behavioral health because they are there for you to, for reducing stress, improving your sleep. Sleep is so important. These apps are very, very popular. You can access them by going on kp.org/self-care apps, and you can download them from your Kaiser account. Once you create an account, then you can start using them on your tablet or your smartphone. And these, again, do not take place of your care with your therapist. This is an additional. If you're, if the situation is not so severe, you can join these apps and take advantage of what they offer. Again, the Calm app is very, very popular. And if you were to download it from just outside of Kaiser Permanente, there is a cost attached to that. But they are for practicing mindfulness, meditation, reducing stress, and sleeping better. I myself tried it to help me sleep because I had a big day the next day. I just couldn't sleep. And also my mom, I was worried about my mom. Anyways, I couldn't sleep. So I used the Calm app to help me through that, to help me sleep. And it does work. And my son also uses it. And they also have sleep stories for children. And I have some of my colleagues that use it to tell stories for their children as well, for sleep stories. The Ginger app is a text-based emotional support coach. And this is for adult members. And these are highly trained coaches that are available 24/7. And they personalize the support for your common challenges. And again, it's text-based, available 24/7. They discuss goals with you, share challenges, create action plans, and they view recaps from each texting session. Again, you get interactive skill building tools, and you can track your progress. The My Strength app is a little bit more on changing behavior. And this one was approved by our therapists here within Kaiser Permanente so that we can offer it to our members. And again, it's to strengthen your emotional health. So you get little reminders, how's your day today? You can answer the questions, and they provide recommendations. So they're all really good. You can use them all or use one of them, but they're part of your membership resources. Oh, I talked about the emotional support Ginger app. We're very proud of this app. It was introduced late last year, and it's very, very popular. I do want to mention, yes, it is at no cost, but it's available. Once you sign in, it's available for 90 days. And then after a year, it resets and you can start using it again. If you feel that you need a few days later, a few days more after your 90 days, please connect with that coach to see if they can make an exception for a little bit longer. But connect with your coach if they will allow that. But it is available for 90 days. So let's talk about benefits of taking care of yourself, not just when you're sick, but also when you're healthy. And so we're talking about the wealth of resources that you have. Being a Kaiser Permanente member, you have preferred rates for acupuncture, massage therapy, and chiropractic. It's through an organization called American Specialty Health. And you do not need a referral from your Kaiser Permanente doctor. You can call them directly, make an appointment, and they'll provide you with that preferred rate. It's about a 25% discount. You also have gym membership discounts, the healthy lifestyle programs, and I mentioned the telephone coaching and the class pass up. I'll talk a little bit more detail shortly. So the class pass, that's another application that's available for you. This particular application provides over 4,000 on-demand fitness classes, anywhere from yoga, tai chi, boxing, cardio, even dancing. I like the dancing one. I tried that one. I'm making sure I don't hurt myself, but it has all kinds of different types of exercises that would be that would work for you. They also provide discounts for for certain gyms throughout your neighborhood, and you would just provide your zip code, and then it'll provide you with the centers that are available close to your area. I mentioned the wellness coaching for stress reduction and helping you sleep, which is good for your mental health. They're also available for other topics: nutrition, fitness, weight reduction, and smoking cessation. Those are your other topics that you can choose from. So these experts, what you do is you call them, and then they'll do a getting to know you type of session. The initial session will take about 30 minutes, and then you can set goals, and you can see them every or talk to them every week or every other week. It's all up to you. And you can adjust your goals as you go, what's realistic. It's very, very effective. Again, these are telephone coaching available at no cost to you. And you don't need a referral from your Kaiser Permanente doctor. They are Kaiser Permanente in-house. So these are health educators that have access to your electronic record. So if you have a certain chronic condition, they can tailor it for that specific chronic condition. So again, they have access, which makes it better for you. You have thousands of healthy cooking recipes. The kp.org website has, it's available to the public. So there's recipes, there's health encyclopedias, there's drug encyclopedias, and you're seeing the recipes. It has interactive tools as well available to the public, not just Kaiser Permanente members. The health education classes and programs, these were intended to be in person. For the most part, I believe there's probably 3 or 4 topics that are necessary to do in person. Some of them are still being held virtually because of COVID, and eventually they will go back to in person. But for the most part, these classes are very detailed, available to you at no cost, and it anywhere from having a healthy heart, emotional wellness, which has several sessions, high blood pressure, cholesterol. Those are the types of classes that they have. The very popular one, which a lot of you may be familiar with, is the Healthy Balance class. It is available at no cost to our members, and if you were a non-member or not a member yet, I believe it's about a $50 cost and $10 for each session. So it's a total of, I believe, 10 or 12 sessions, and they touch upon every part of you, from eating well, reading labels, to nutrition, fitness, how to take care of yourself and your exercises, to your stress reduction, just the importance of not having so much stress. It just covers so many different topics, and it's just very informative. I took it myself, and when I'm out there talking to the folks from the county on open enrollment meetings or health fairs, a lot of them tell me that they want to take it again because it was so informative. So again, that's available to our members at no cost. Then you have the web-based coaching. You fill out the health assessment online. A lot of you are very familiar with this. And then you can join interactive programs on so many different topics. Again, improving your mood, focusing on your sleep, and so many other types of programs. So I talked about the reduced rate, the preferred rate for acupuncture, massage therapy, and chiropractic. There's also a resource library on thousands of health articles, and there's also discounts on herbs and vitamins and so much more. So when you have an opportunity, go in there so you can see what's available in there. The active and fit that you see down here, this particular program is a fitness membership. It has over 12,500 fitness centers throughout the nation. And basically you sign up, it's a $28 registration fee, and then it's $28 a month. I know LA Fitness is in there, Curves is in there. The 24-hour fitness is not in there. I don't know why. It used to be in there, but they took it out for some reason. But there's a lot of the different fitness centers. And if you wish to switch during the year to a different gym, you can do so. You can just request it to change to another gym. But that's another resource that you have. So let's talk a little bit about your benefits. So with regards to the traditional HMO plan, which is the high plan, it's much richer. This plan, there weren't any changes. You pay $25 to see your doctor or your specialist or even urgent care. So it's a rich plan. Your preventive care is covered at 100% for both traditional and the high deductible plan. And then telephone visits, remember, and video visits are covered at no cost for the traditional HMO plan. And your outpatient surgery, you can see here, again, $25. I was at another company yesterday and it was $150 for their outpatient surgery. So again, very rich benefit. Labs and x-rays, again, 100% covered. If you're hospitalized, the copay is $100 per admission. What that means is if you're admitted to the hospital and you're there for 2 days, a month, it's $100. That's what that means. Emergency room care, if you go to any emergency room, not just Kaiser Permanente, for your life-threatening, threatening to your health type of emergency, it's $125. If for that particular visit, if you're admitted to the hospital, that $125 is waived, then you're subject to the $100 per admission. Your outpatient prescriptions, you have a $10 copay for your generic medication and a $30 copay for your brand medication. And take advantage of the mail order, either doing it online or calling over the phone and having it to your, sending it home. So you're saving yourself time and you're saving yourself an additional copay. And you get up to 100-day supply by taking advantage of the mail order capability. What was I going to say about this? It'll come back to me. So that's your traditional HMO. And again, very rich plan. The high deductible health plan is a special type of plan that has an HSA qualified program, which means you can have a bank that's HSA qualified, and you can put money aside, save money on your federal taxes. When you put that money in there, either be pre-tax or do it when you file your income tax returns, and you can use that money that you save from taxes to pay for your services. And this particular program has a high deductible. That's what it's called. For individual, it's $1,600. And for a family, total, whether it's individual or family, is $3,200. That's the deductible. Once you meet the deductible, then your benefits start working, which means that you pay 10% of the cost of the care. Whatever the care is that you're doing with, if you're going to get lab work, if that particular lab work is $20, then you pay 10% of that $20. So 10% of whatever the cost is for that service. And remember, preventive care is 100% covered. These are your cancer screenings, mammograms, colonoscopies, anything that falls under preventive. Now, the telephone and video visits, I mentioned that there's a small cost. Once you meet the deductible, it becomes no charge. So that's how that works. And for your prescriptions, once you meet the deductible, your prescriptions will be a $10 copay for generic, and then a $30 copay for brand, just like your traditional HMO. And again, take advantage of the mail order, saving yourself a copay. Now, the maximum yearly out-of-pocket, you have $3,200 for self, and for individuals, within a family is also $3,200. And then for family total is $6,400. So you've paid your deductible, you've been paying your co-insurance. Once you reach, as an employee only, once you reach $3,200, you are covered 100% for your covered services for the rest of the year. Starting January 1st, that following year, it resets and it goes back to zero. And that works the same with the deductible. Now, this is a little tricky here. So once you meet the deductible for individual, it looks like you already met your maximum. So that one person in the family has reached their out-of-pocket maximum. That one person doesn't have to pay any of the covered services for the rest of the year. This includes medications, this includes your labs, or seeing their doctor. So the change this coming year, effective January 1st, is the change that the deductible and out-of-pocket was moved slightly up. So this is the new deductible and out-of-pocket. And this is IRS driven plan. So this is required by the IRS. And then I'll pause here, Nidra, to see if there are any questions.
So far, Charlotte. Oh, sorry.
Oh, go ahead, Selena.
Oh, I was just going to say, so far, there's no questions.
Thank you. Okay, so I'll keep going. Remember, we're here for you. So if you have questions, please put them on the chat, and we can answer them, and other people can learn from you too. From me too. Okay, so let's talk a little bit about the high deductible plan and the resources. What's going on here? I think oh, there we go. So if you are on the high deductible plan and you're registered on kp.org, you have access to the, there's a special phone number that you can call if you have questions, and they can help you with where you're at on your deductible, where you're at on your out-of-pocket maximum, check on claims, and get estimates. But you also have access to that on kp.org. You have those same capabilities online if you're registered on kp.org, which makes it much nicer. It allows you to be proactive when you do estimations, what to expect. You can track your deductible and you can track your out-of-pocket maximum. So it provides all sorts of capabilities. If you happen to be in a situation where you have a big procedure and it's expensive, and you can call this number and arrange for payment plans, or they'll see if you qualify for other resources. But that number, you would get that number if you sign up with this type of plan, but they can help you with that. They added a prescription estimation tool as well. As you know, with a high deductible plan, you have to pay full cost of the medications before you meet that deductible. So this also allows you to know what to expect as well. And then once you're done with a certain visit or procedure, a service, you would receive after your visit an explanation of benefit, and it'll give you a detail of what the costs were, what was paid by the health plan, and what is your responsibility. And again, you can find all this information on your kp.org account as well. For the County of San Diego employees, you have the kp.org website, but you also have a customized, dedicated website for yourself. All employees can access this website, whether you're members or not. And we're going to update the benefit summaries now that you're going through open enrollment, but you can pull your SBCs, your evidence of coverage, which are more detailed information about your benefits, or download your benefit summaries as well. This customized website has additional information that we put there for your convenience that may be important to you. Maternity care, there's a brain shark on the high deductible health plan. And for folks that are new, it provides additional information, what to expect and what to do when you sign up with with Kaiser Permanente. This particular slide talks about the different organizations out there that are reputable, and they do audits to the health plans. And you can see that Kaiser has been top rated for the 7th year in a row from the National Committee for Quality Assurance. So that means we're providing high quality health for our members. This one's for behavioral health. And then this one is the HEDIS, which is the Healthcare Effectiveness Data and Information Set. HEDIS, leading California in 74 effectiveness of care measures, which is preventive care. We're doing really, really good on that. And again, 74 other measures. So these are just reputable third-party organizations that provide ratings for the health plans that are out there. So the map of Kaiser Permanente in California, I just want to show you really fast what Northern California looks like. If you happen to have a student that's out there, they can access any of those. They do get their own medical record number in Northern California or any of the other Kaiser states and receive routine care. And then Southern California, you can see that we're all over in the Southern California region. Here's the San Diego area. And lastly, here's some of the facilities in Southern California that have recently opened. The Claremont Mesa Medical Office Building, which is outpatient, opened a couple of years ago. And now our new hospital, San Marcos Medical Center, opened a month ago. So we're very, very fortunate. I live up here in Vista, so we're very happy to have our hospital up here in San Marcos. And here's a picture of what the hospital looks like. We have a QR code that you can take, do your photo at and access the tour. And after I'm done with the presentation, if there's no questions, we're here till 3 o'clock. And I'll just run a small video of going into doing a virtual tour of the hospital. But the hospital, similar to the San Diego Medical Center in Kearny Mesa, has robotic surgery, interactive single patient rooms. It's really state of the art. And our new mothers have single rooms for single folks. You're no longer have a roommate when you're there for postpartum care. And it also has a NICU, which is the neonatal ICU for our babies. So in Southern California, we have that additional option of services provided by our target clinics. Here in the county of San Diego, there's one in Chula Vista, Encinitas is the newest, Mission Valley, Santee, and Vista. So all these target clinics, the newest one this last year is Seal Beach and Moore Park. They just added those. And these are, they're sort of a downscale of an urgent care that you can be seen on a walk-in basis, but you can also make an appointment ahead of time to avoid having to wait. They'll probably give you a remote if you're waiting, and you can go shopping while you're waiting for your appointment. But they're available every day up to 7 o'clock at night, and they handle minor injuries and minor illnesses. You can also get your flu shots there or have a sports physical for your child. I did that with my son for football. And again, they have the electronic medical record, and they're provided by Kaiser Permanente clinicians. So you'll be seeing a Kaiser Permanente clinician that has access to the electronic medical record, so your appointment there gets registered and your regular doctor can see that information. It's logged in as your appointment history. Now, they do have a pharmacy there, so you can use that pharmacy for that visit, bring your prescription, and just pay your copay. Any additional refills or any ongoing care, you would need to come back to your Kaiser Permanente doctor. But again, just providing you additional services for you and your family. If you're planning to join Kaiser Permanente, we have a new member onboarding website, and we do have a team that onboards you, helps you set up and register on kp.org and onboard you and establish yourself with a physician, and they assist with the transition of the prescriptions as well as your medical records as well. Some of the other providers out there in the community have, I think, Epic, which is a very similar electronic record, which just by an authorization from the member, by pressing a button, it gets transitioned over to Kaiser Permanente. So again, makes it very, very seamless to our new members as well. So in summary, we provide high quality personalized care. We make it convenient for you with our one-stop park once and get all your care, our technology where you can see a clinician 24/7, and then all of our added value resources on wellness, chiropractic, and so much more for you as well. And I invite you to join Kaiser Permanente. Here's an additional telephone number that you can call after this meeting. If we're not able to answer your questions or you think of a question, you can call this number. This is not the member services number, but they help with questions, just general questions on Kaiser Permanente. And they're available Monday through Friday from 7 in the morning to 6 p.m. Pacific time. Thank you so much, and we'll be here until 3 o'clock. I'm going to check in again with Selena to see if there's any questions.
Hey, Charlotte, one question came through. If an employee or a person who is enrolled in Kaiser calls in and they're not able to get an appointment straight away, but they are feeling sick and need to be seen, before 1 to 2 weeks, what are some of their options if they're experiencing a delay in getting an appointment for their request?
So a delay in a request. So it all depends. Is it a routine visit? If it's urgent, we do have our urgent care centers. And we also have the clinician 24/7 that they can talk to someone over the phone or video, or leave a message with their doctor to talk to the doctor. The doctor can respond to that question. They can also leave a message. The other piece is make an appointment with another doctor, and they are able to do that as well. So it all depends on the situation, but if it's urgent, we have the urgent care or make an appointment with another doctor. You also have the 24/7 clinician, or let's see what else. You have the advice nurse line as well. So it all depends on that particular situation.
Okay. Another question is, if someone needs to see a specialist, someone like a neurologist, a urologist, etc., do they always need to go through their primary doctor first to get referred to one in Kaiser, or is there a plan or other option that lets them make an appointment with a specialist straight away without seeing their primary care physician?
So with Kaiser Permanente, the departments where you could just call directly and make an appointment are optometry and mental health and OBGYN. All other specialties, you do need to go through your doctor. If your doctor knows you already and you've already been, he's been taking care of you, you can simply ask your doctor via email or call and leave a message making that request, because they can probably refer you that way, or probably you may think that it's that certain specialty, but based on your situation, your doctor may say, nope, it's not that, it's this other specialty. But that helps you in the long run. But once you're referred to that specialist, you don't have to be requesting over and over an appointment again to that specialty. You do need to go through your primary care doctor.
Okay, thank you. Another question, maybe you can give us a little insight, and we realize you're not going to be able to go into a lot of detail, but Kaiser participants are expected to receive increase in premium cost. And do you have any insight that you can provide regarding why there's a rate increase?
The rate increase. Alec, can you help me with that? I know that we are a provider in addition to the health plan. And because of all these other grocery bills, transportation, gas, all that is increasing. So we are being impacted immediately because we are the integrated model. I could think of that, but there's so many other variables, and I don't know if Ella can help me with that.
Yeah, so just to piggyback off of what Charlotte said, it's mainly, it has a lot to do with general inflation, like she was saying, gas and groceries and whatnot. There is also inflation in, general healthcare pricing and equipment and wages and stuff. So that's mainly where we're seeing this increase coming from for the most part.
Okay, thank you.
Thank you,
And
Alec.
then another question, is the high deductible plan a PPO or HMO?
So the high deductible health plan is, I don't know if you would consider an HMO. They call it a HSA qualified. It would be the same doctors, same type of care. The only thing that's changing is the way you pay. So I don't know if it's called a traditional HMO. It's technically yes.
Yeah, I
But you
believe
have,
it is. Yeah.
yeah. Thank you.
Okay, and then one question just came in. Like, just give me 1 second to review.
Sure. Thank you.
Okay, so this is for a person who's considering enrolling in Kaiser for 2024, and they would like to know, is there a place where they can estimate how much a treatment would cost so they can compare it to their current plan?
So there's an estimation tool that that you would have to be a member and go through the kp.org account to get that. But I think on the microsite, we have under additional resources, a sample fee list that you can see. And again, those are just estimates. So it's my.kp.org/SD county. Let me go back. And there should be a sample fee list in there. that may assist with that. Oh, I didn't put it there. I need to put down the web address. It's my.my.kp.org/SD county. And if you click on plan options, it will take you to the next page. And on the bottom, it'll say additional resources. And you should be able to see a sample fee list for this year. And it's I think it's 3 pages long, so it's high level, but it gives you a picture of what the cost would be. Hopefully that answers the question.
Okay, if not, if the person who asked that question, you can also email the benefits division if you want to go into a little bit more detail, right, regarding your own personal situation. And we can dig a little bit into your question for you. So you would just email us, and I'll put the email in the chat in a second, in case you're not able to find what you're looking for on the microsite. So another question, is the 25% discount on chiropractor acupuncture on all of the HMO plans? Is that something that is automatically discounted upon payment, or how does it work? So can you go, a little bit more into how the wellness acupuncture chiropractor that works for people?
Yes, so when you call them and you let them know you're a Kaiser member, they have some sort of agreement with Kaiser Permanente. So if you give them your medical record number, they'll see that you're a member, and they automatically will give you that discount. They will let you know what that discount is and what the cost would be with the discount.
Okay, so far, no more questions, but we can just wait and see if anything else comes in. For a follow-up for what you had just gone over for the Choose Healthy program, let's see. The follow-up question is that only available through the ASH network or ASH network?
Yes, it's only through American Specialty Health.
Thank you. Charlotte, sometimes we get this question, it's a common question, it's not being asked in the chat, but can you go over the students who may be away at college, what their options are, how that works? Can you go over that, please?
Sure, let me see where I had it. Okay, it's way over here. Yeah, it's basically the same with students. Let me go back just to kind of, where did I put it? Excuse me. Let me go back, sorry. I like to look at it so you can see what I'm talking about. Okay, so when someone is a student, it works the same way as for any other member, and students are unlimited basis. So if you have students that are in the Kaiser Permanente states, they do obtain a medical record number for that region, and they can be seeing a doctor as if they were down here in their home region. So they can take advantage of that when any of the 9 states that you see here, including Hawaii. If you are outside of the Kaiser states, emergency and urgent care is covered. If you happen to be close to a network provider that falls under the Cigna PPO network, again, this is for urgent care. Cigna PPO network, the Minute Clinics, Concentra Urgent Cares, you just pay the $10 copay and be seen for that visit. The Minute Clinics, you can use a pharmacy and pay your copay for that visit, for that prescription on that visit. And again, we have the 24/7 virtual care that's available when someone has a needs to speak to a clinician. Again, available phone or video, and it's available 24/7. Any routine care outside of the Kaiser states is not covered. So I just want to make sure everybody's understands that. A lot of our students, what they do is they know they're taking care of urgent care and emergencies, but they schedule their routine visits around when they go home and see their provider at that time. You can always email your doctor if you have questions, but it's very similar to any member that is traveling in the United States.
Thanks, Charlotte. And I was listening throughout the presentation, but not paying super close attention. Did you go over the, you know how there's the different, the wellness facility that's in Kearney Mesa and the different options that participants have in using some of those resources? Do you know what I'm referring to?
Yes, the Positive Choice Wellness Center.
Yeah, did you go over that?
You know what? No, I'm going to add a slide for the next two meetings. The Positive Choice Wellness Center is in the Garfield location, the 5th floor, I think it is, or the 6th, and that whole floor is for that center, and it's available to the public. They offer a lot of services at no cost, but most of the services are fee-based. They're mostly known for their full liquid diets, the OptiFast, which is monitored by a doctor. And then they go to the not so, the half liquid, half meal plan or full meal plan. They have different levels of programs. But they do have other programs such as biofeedback, you know, someone that's stressed, how to learn how to breathe. I can't think of anything else, but they have workshops sometimes that are available online. And let's see, I'm trying to think what other things they offer, but it's pretty comprehensive. They do have satellite offices in Otay, East County, and San Marcos for those other programs such as the full liquid diet. I don't know which other ones have been added, but it's positivechoice.org. Let me just verify that. But they have exercise programs on video. It's pretty cool. Let me see. Positivechoice.org. Yep, positivechoice.org. Weight loss options, mindfulness, practicing mindful fitness. You can stop by, ask a dietitian questions at no cost. They have exercise videos. They have information in Spanish. I went there and I saw a doctor on integrative medicine, and that one's a couple $100. It's expensive, but they go over your entire plan. They can see your lab work, and they tell you what types of vitamins to take, what to eat. What else did they tell me? It was a pretty cool visit with one of the integrative doctors, because they're the entire person. Yoga is so important, and they just told me all these different things, but it's pretty comprehensive. Evaluate a person's entire lifestyle, then create a lifestyle plan for balance and overall wellness. They use traditional Western medicine therapies where needed, and then incorporate proven alternative medicine therapies to enhance recovery from illness and maximize wellness. It's a pretty cool visit, but again, they have so many different programs in that department, and it's available to the public.
Okay, thank you. And then I missed this chat question earlier, but what is the process for someone who wants to see a specialist? So someone who wants to see a neurologist or urologist or someone like that. What does the process look like for a person who needs to see a specialist?
So, it depends if the person is new or if so, for example, you do need to talk to your primary care doctor. And they're the ones they're in charge of your care, and they decide if you need to go to a specialist, and they make that referral. If they know you really well, just either call them or email them, let them know what your wish is, and they'll do that for you. I've done it many times myself, for myself or my husband. But if you haven't seen your doctor in a long time, they're probably going to say, I need to see you first before we make any determination. So it all depends on your relationship with your doctor. But yeah, they need to approve the referral and make that referral for you. And you know what? Again, the departments you don't need a referral for are mental health, optometry, and OB/GYN. With those, you just call directly and make the appointment. All others, go through your primary care doctor.
Thank you. One other question. I'm not sure how familiar you are with the KP app, but if a person is trying to make an appointment using the KP app and they're not getting a lot of options, so this person stating they were only given 2 locations and it only offered one doctor option one time, is there a way to expand or filter their request in the app? How familiar are you with the app? Are you able to show us anything or advise?
You know what? I just know that they go based on what's going on in the community. If it's now, I think that whole COVID on and off being in person, I think we're over that. If you're not seeing that many options, I would call my doctor to see what's going on. I know that we're ramping up for the flu season and it's getting hard and it fluctuates. But you can, if we're talking about your doctor, I would call and see what's happening. I don't know if it has anything to do with the filters, because once you click on, I need these days or whatever, then it shows you based on what you added. And sometimes, because that happened with my husband with his doctor, and then we learned that he was on vacation. So it prompted us to use another, ask for another doctor. So I think, I hope that's what's happening, but I would call my doctor if they're not getting what they need.
Okay, thank you. So far, no other questions, but we can hold on and see if anything else comes in. And if I could think of any FAQs that I get, I'll throw them your way.
Sure, thank you. So we'll hang out here for another hour in case any other questions come up. We're here. What I can do is show them the virtual tour of the San Marcos Hospital. Let me see, where did I put it? Is it this one? No. Okay, so I'm gonna try this. Is it his? Oh, here it is. So Selena, just call me and I'll stop this the video if somebody has another question. What do you think?
Okay, sounds good.
Okay, so I'm gonna share and unshare and put a computer sound. I'm gonna play this. I think it's pretty cool.
Welcome to the San Marcos Medical Center's Maternal Child Health Center. Our goal is to provide you with a VIP treatment from the moment you arrive. This begins with special parking spaces reserved just for expectant parents. We like to have everything ready for you when you walk through the door, so please call when you are going into labor and are on the way to the hospital. Once you have arrived, we'll check you in and assess your labor progress. Next, we'll get you settled in your own private room. Throughout your labor, delivery, recovery, and postpartum stay, our specially trained nursing team will coordinate with your obstetrician to provide you with the very best care using the most up-to-date procedures and state-of-the-art technology. We want to make sure this moment of bonding with your newborn is intimate and special. Friends and family are wonderful support during this time, and visitors are always welcome. Breastfeeding offers many natural benefits, and we encourage all moms to breastfeed. All of our perinatal nurses have specialized training to provide breastfeeding support. We also have expert lactation consultants to help provide additional assistance if needed during your stay. While most babies arrive ready to take on the world, some need a little extra help. Our Neonatal Intensive Care Unit, or NICU, is ready to provide the very best medical care should your baby need support getting off to a healthy start. At the San Marcos Medical Center's Maternal Child Health Center, our highly trained medical staff and technologically advanced facility combine to provide you with the very best care, support, and safety you and your family deserve.
How do I do this? I'm gonna take myself off the camera and put this back. Do you see any questions, Selena?
Yeah, can you let us know if Zion Hospital offers labor and delivery?
Zion Hospital offers many specialty type of surgeries and like orthopedics is there. They do share a lot of the services, but labor and delivery was transferred over to the new San Diego Hospital, and it's only there. It's not at Zion.
Okay, and the new San Diego Hospital is the one located about maybe about 10 minutes away from Zion off of the
Yes,
15
yes.
freeway. It's by the
Off of-
COC campus.
Yes, it's not too far from the COC campus. If you traveling on the 15, if you're in Zion, you get on the Friars and then on the 15, and you go a little bit north, and then on Claremont Mesa Boulevard, you make a left turn. As soon as you make a left turn, you'll see the huge hospital, and that's where the maternity, labor and delivery, that's what they have in there, in addition to all these other specialties that they share with Zion. But that's the one specialty that is not shared with Zion. It's handled through the San Diego Medical Center off of Claremont Mesa Boulevard.
Thank you. All right, so far no more questions.
Okay.
Charlotte, this is not a question in the chat, but a frequently asked question regarding family planning options. So sometimes employees want to know what their options are when it comes to maybe infertility or those types of situations that families experience.
So we have a comprehensive fertility center. If you're a member of Kaiser Permanente, you can ask ask your doctor to give you the phone number to the fertility department to schedule a visit. I do want to mention that, let me look at the, where is it? Okay. The traditional HMO covers fertility services. Let me look at the actual, because it's not here on the my little summary that I provided. So let me see. Oh, it's over here. Hold on. There's, I just want to show, if you go to the EOC, it'll provide a lot more information specific to the service. But for the right here where it says services to diagnose, treat fertility and artificial inseminations, the cost share you would pay if the services were to treat any other condition. So if you're seeing a provider, you would pay the $25 copay. If you need lab work, it would be covered at 100%. According to this, artificial insemination is covered. I know for a fact that in vitro is not covered, but that they'll give them the breakdown because each case is so different. It's best that they get like a write-up by that provider when they go for their visit, because there will be some services that may not be covered. But for the most part, the office visit would be $25. Labs would be 100% covered. And I don't know about the medications. Does that help?
Yes, thank you.
You're welcome. Yeah, and I'll add that positive choice because it's a very popular department. Oh, I didn't mention this, but fertility services is not covered under the HSA plan. Let me see if I can find it. Oh, I thought I had it. Hold on. That's traditional. Here's, okay. Let me see if it tells you right here. Oops. It may tell you right here, so you know, diagnosis and treatment for infertility, not covered. This is the high deductible plan, so it's not covered on the low plan.
Hi, Charlotte. This is Idra here. I've gotten a couple of questions in the past regarding the high deductible health plan and the health savings account affiliation. Is that administered through Kaiser as well on the HSA account?
Oh, you know what? I thought you had Optum.
Okay, it is Optum. Okay.
It is,
Thank
yeah.
you for confirming.
Sure. I should have mentioned that. You know what? There's so many cool things about this HSA product. Do you have Optum presenting on the finance portion?
Yes, we do have Optum. Let me look for that date because if there's anyone else on this webinar who's interested in that date, I can,
We can give them that, huh?
yeah, be a good thing. It's going to be next Wednesday, September 13th at 1 p.m. So
good.
those of you who are interested in finding out more information about the health savings account that's affiliated with the Kaiser High Deductible Health Plan, that session will be with Optum Bank on September 13th. Charlotte, I don't see any more questions coming through the chat.
Okay.
It's likely we can move forward with concluding the webinar. And if anyone has any questions, they can
Sure.
always reach out to Benefits Division. Charlotte, do you have any closing remarks or comments you'd like to make?
Oh, no, thank you. I just encourage folks that are interested to join Kaiser Permanente, and I think it's a great health plan. And thank you for having me, Deidre. And I will see you in the next one.
All righty.
Number 2.
Sounds great. Thank you as always, Charlotte. And
You're
thanks
welcome.
everyone for joining us today. Have a great evening.
Take care.
Thank you.
Thank you.
Thank you.